It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
All right, our next guest, Dr. Doug Backous, board certified in otolaryngology from Puget Sound ENT, Cochlear Implants. That's got to do with the ear, I take it.
Yeah, hearing loss and implanting this cochlear implant, restores hearing for people that are young and old. It's an amazing device.
All right, here's Dr. Backous and Shannon O'Kelly.
Dr. Backous, welcome back. How are you?
Doing well.
Tell our listeners again, you're a neurotologist and you work in a number of different areas and primary areas hearing. Tell us what a neurotologist is again.
So neurotologist is an ENT doctor who did an additional 2 years of fellowship training. So I'm actually board certified in ENT and also take out tumors in the lateral skull base and brainstem and do advanced intracranial surgery.
Give us an idea, like what is a day in the life of Dr. Backous? What does your practice look like?
Well, I started out at a really good coffee shop in Edmonds, and a day like today, I'll go and put a hearing device in a child, and then I go to the next operating room, the next case, and we'll take a brainstem tumor out today. Let's
talk about hearing. I mean, it's so important. Last time you were on, you talked about all the reasons hearing is so important. Let's talk about how we hear and the sensitivity of hearing.
So we basically hear by two mechanisms. There's a conductive piece where the sound comes through, hits your eardrum, and hits your ear bones, and that's about a 28-to-1 amplification to the inner ear. And then the stapes bone moves in and out of the inner ear like a piston and generates a fluid wave in the cochlea, which generates an electric signal to your nerve, which goes to your brain and says you're hearing.
And so you hear by amplitude or sound. What about sensory? Is there any kind of component to hearing that's dependent on sensory?
Absolutely. So the conductive piece is the actual mechanical movement of middle ear bones. The sensory neural component is that fluid wave which transmits a signal which becomes electric to the brain, and that's all sensation through the hair cells of the inner ear, the nerve, and then the brain that actually hears.
So basically you hear by amplitude of sound waves causing water waves that facilitate hair cells that cause hearing sensation.
Absolutely. You get a mechanical movement from a sound pressure, which is converted to a fluid wave, which generates an electrochemical reaction, which generates an electrical signal in the nerve, which generates a signal to the brain. It's pretty cool.
Yeah, I would say it's so cool. How do you as a physician influence hearing and understanding that and diagnosing it? I mean, it's so complex. I mean, these bones are little tiny bones. I mean, they're not large bones. I mean, it's a very sensitive area and it's complex. How do you get involved?
So surgically, there's a surgical side and the non-surgical side. Hearing aids are really progressing in a very advanced rate. They can actually pick different programs for different listening environments, and really that's expanded people's ability to hear. But on the surgical side, we can fix those little ear bones. We can replace them. We can work around them with certain devices like the Baja or Ponto, which are the osseointegrated devices. And then to get into the inner ear, put an electrode in the inner ear and stimulate the nerve. Even though the inner ear is not working, we can restore sensory hearing with the use of a cochlear implant.
Hold it, hang on. So let's talk about this. Let's dive down. Let's do a deep dive here. You're talking about, like, I can get a total knee, I can get a total hip. Are you telling me that if one of those bones, it described the bones that are involved in hearing. I think you described one of them, but you can replace those bones. You can get a prosthetic bone and put it in there?
Absolutely. You have the incus, the stapes, and the malleus. That's the hammer, anvil, and stirrup that we learned about in high school. And we can replace those. And we can actually leave tendons intact and put little pieces of titanium and bone matrix in there to reconstruct the hearing mechanisms, the mechanical piece. But that's really assuming that the inner ear is working well.
And how do you define which is working or diagnose this?
We use a hearing test called an audiogram, and there's lots of people around town that can do that. You can actually go on the internet now and do your own audiogram.
People that have hearing loss, let's talk about age groups. Who generally has the need for cochlear implant?
So cochlear implants are from birth until we did 2 people last week in their 90s that are living independently and don't want to move into a nursing home. And we kept them independently living by giving them their hearing back so they have a much safer environment at home. We also diagnose kids at birth. We screen hearing within 2 days of birth, and we'll get a cochlear implant in a kid 9 to 12 months after birth to get their hearing and language development on track, because hearing is essential for spoken language. The older folks, hearing is really necessary to keep them from getting isolated, keep them engaged in what they do day to day. It's what really keeps people from getting depressed, from getting demented, and actually from getting isolated.
More with Doug Backous and Shannon O'Kelly next on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
Okay, we continue our conversation with Dr. Doug Backous and Shannon O'Kelly talking about cochlear implants right here on Como.
Dr. Backous, again, thank you so much for joining us. We're talking about hearing, and more importantly, we're talking about cochlear implants. I mean, you set it up where there is the mechanics of hearing, then there's the sensory component of hearing. And if there's a problem in the sensory side, that's a nerve side. What does a cochlear implant, maybe talk about that. What does it do? How does it benefit the patient? What is the mechanism of the cochlear implant?
So there's two things to think about conceptually. One is that there's no such thing as nerve deafness in the inner ear. The majority of the time it's those little receptors, those hair cells that don't work in the inner ear. And we can use the cochlea, which is called the cochlea because it's shaped just like a snail shell. We can use it as a Cinderella slipper. You just slip the electrode in, and we can actually, by specific tone or frequency, we can stimulate the cochlear nerve to replicate all the signals necessary to make the nerve fire to the brain. So basically everything except that inner ear is in good shape. So we use the damaged inner ear to house an electrical stimulator to turn the nerve on.
So you're stimulating the nerve which has been damaged or inactive or has got some kind of genetic component where it's not functioning.
It's typically not the nerve. It's typically the inner ear that feeds the nerve.
Okay.
So it's your microphone's bad, but your amplifier is still working. So we got to get sound to the amplifier so people can hear your concert.
Okay, so and how do you put these things in, and how do they work? And I mean, it's fascinating because I've seen on Facebook. I mean, it's amazing. I've seen where they do these cochlear transplants or implants with a child that maybe hasn't had hearing and they're 4 years old, and you see them hear for the first time. You've probably seen that, experienced that. What amazing thing to be part of, right?
No, it's fantastic. I think there's the infant who hears for the first time and all the parents cry.
Right.
What's
yeah.
really impressive to me is when grandpa, who hasn't heard for the last 20 years, puts a cochlear implant in and hears the grandkid for the first time.
Oh my gosh.
It's really powerful, and you can just see lives get recreated. And so we do this surgically. It's about a 1-hour operation. We do it under a microscope with people asleep. We drill through the mastoid bone, which is the sinus behind your ear, and we actually fix the implant to the side of the skull, and we run the electrode through the mastoid into the inner ear, and then we seal it all up, let the person heal for about a week, and we switch them on.
Does insurance cover these, and what's the deal with all the medical insurance? And because there's a huge need out there, I can imagine.
Absolutely. So there's Medicare or CMS criteria, and there's Food and Drug Administration, FDA criterion that we follow very closely. But almost all insurance plans cover them. The only glitch is what your deductible is on your insurance, what you're responsible for. But these are fully covered by Medicare. They're fully covered by third-party insurances in most cases. Even Kaiser has a very good coverage for cochlear implants.
And I think you were saying off air, I thought you and I were talking about the number of these that your group, or a number of these that are done here in the Puget Sound. I mean, talk about how many you do.
So we do about 70 to 75 a year in our surgery center, our outpatient surgery center, and we've actually built a network of audiologists going from central Washington to Aberdeen, up into northern Washington and out in the Olympic Peninsula that actually will care for these patients closer to home. So they just come to me for surgery. They get all their assessment and their audiology programming, which is actually a pretty complex process. You know, they connect these cochlear implants, which are microcomputers, to a laptop, and they program frequency by frequency until we recreate sound, sometimes as good as even hearing music.
Wow, fascinating stuff. I mean, I'm so impressed with what you do. I mean, it's amazing that you're changing lives. Hearing is so important. Dr. Backous, thank you so much for what you do, and thank you for joining us.
My privilege. Thank you.
Cochlear implants has been our topic with Dr. Doug Backous, and you can get more information at PugetSoundENT.com. There's a lot going on with the ear, nose, and throat, Shannon, that a lot of us don't understand, and it's nice to have a doctor like Dr. Backous to explain it to us.
Amazing guy. I mean, it's so fascinating to talk to him, and what he does, he changes lives. I mean, if you've ever seen those Facebook posts where a young child gets a cochlear implant and hears for the first time, it's just amazing.
We're back with our final segment next.